So sinus headaches are really a big subject and a topic of a lot of conversation and a lot of research in our field. Certainly, you can have a sinus headache due to a sinus infection, but it's really not that common. When you do have a sinus headache due to a sinus infection, it's often due to trapped pus or trapped mucus, something like a mucus seal or a mucopia seal, where there's a pressure effect inside of the sinuses. Or you could have a severely deviated nasal septum that's creating a pressure point inside of the nose. So if you have some sort of nasal inflammation or swelling, it can enhance pain in that area and trigger a headache. But for the most part, when we can think about sinusitis, headache is not one of the cardinal signs or symptoms. Facial pressure, nasal blockage, blowing mucus, or having postnasal drip, those are the classic signs and symptoms of a headache. More often than not, if somebody is having what they consider to be a sinus headache, particularly if they're not having the classic symptoms of sinusitis to go along with that headache, what they're having is actually a migraine. Migraine headache can masquerade quite often as sinusitis, or what people interpret as having a sinus headache. Throbbing head pressure, particularly in the forehead or the mid-face region. It can also be associated with some watery eyes or some nasal stuffiness. And so people quite understandably associate with those symptoms with having sinusitis. You know, the confusion is further compounded by the fact that there's a whole host of over-the-counter medications that are marketed for the treatment of sinus headache. These medications are typically a combination of some sort of anti-inflammatory medicine like ibuprofen, naproxen, or acetaminophen, combined with some sort of a stimulant which acts as a decongestant, like pseudoephedrine or phenylephrine. Those medicines are actually pretty effective over-the-counter remedies for a migraine headache. So very often people will be suffering with the symptoms that we mentioned. They'll go to the store to try to self-medicate. They'll be under the impression that they're having a sinus headache. They'll go to the aisle that sells sinus headache relief medications and they'll take it, and they may feel better. And so it reinforces the idea in their own mind that, hey, you know, I'm having a sinus problem. Well, there's been some really good studies done on this population of patients where they've gotten CT scans on the patient while they're having these throbbing headaches or what they perceive to be a sinus headache. And over 70% of these patients have totally clear sinuses. And if you have clear sinuses, you're not having sinusitis. And so we see a whole host of patients in our clinics who have been going to walk-in clinics or you know, a different primary care type setting where they may not have the technology like being able to perform a nasal endoscope in clinic or being able to do a CT scan at the time of service. And so they have to go with their best impression based on the patient's symptoms. And you know, it's understandable that they're getting diagnosed sometimes with sinusitis and being treated with, you know, a steroid pack, a shot, or a Z-pack. But when you dig further, you may find that most of these patients are having migraines and they actually didn't need an antibiotic. They actually didn't need an anti-inflammatory. What they may need is a migraine therapy.